So in this section, I'm going to talk about what can cause a patient from being acute to be a chronic patient. There are going to be several factors that I'm going to talk about it, but your book actually saying that all chronic pain patients, they were like acute at some point. Yes and no. I mean, it's very general statement. We have to be more cautious because like on the other hand, we do have people that are suffering from cancer. And even from stage one, from the very beginning, all cancer people, I mean, people with cancer, they were like chronic people from the beginning. So we cannot just make that a statement and just make people feel guilty. Because like, yes, there are going to be some factors, but some chronic disease, they are chronic from the beginning. Okay. Keep that in your mind. I already mentioned different factors in previous chapters. I already mentioned that people with neuroticism, they're gonna be more susceptible to like develop chronic condition. But on the other hand, there are gonna be some people that they're gonna be very sensitive about noxious stimulation, or people who are gonna have impairments in their pain regulatory systems. So again, they're gonna be more predisposed when it comes to chronic disease. In general, pain is going to be exacerbated by inappropriate prior treatments. For example, if your doctor, they actually gave you a bad prescription, you're going to develop that sort of disease in your body because like you didn't address that, it's going to be more than 6 months and definitely it's going to be chronic. So you have to just go to the correct doctor. Or if you are actually suffering from the pain even after having that sort of prescription, change your doctor, go to another provider and address that and see how it goes. Because like sometimes you do have a physician, primary one, they are good, but they are not perfect for like every disease out there. So we have to just ask for opinion from different doctors to just make sure we are addressing our problem in a correct way. If your condition would become chronic, your lifestyle gonna change as well. For example, you might just quit your job, you might just abandon your leisure activities, you might actually withdraw from your families and friends because like your condition might be very bad, so you cannot actually hang out with them or even like go to their place, or if they would come to your place, maybe because of your condition, you cannot talk to them at all. So you're gonna be kind of isolated, which we all know that just isolation can be another factor that can lead us to develop chronic disease. But in general, it seems like people with chronic condition, they might require public assistance as well. But I mean, this public assistance also, it can bring us some negative consequences as well, because like it can just be such an incentive for some people that they are, I would say unconsciously, they would just develop that kind of chronic condition because they are just being rewarded by governments. So they are not working and they are just staying at home, getting isolated and all that to just get the reward, and they're going to develop that kind of chronic condition. I hope it would make sense, but I'm going to talk about this part more. People with chronic condition, they gonna experience lower self-esteem, which makes sense whenever you are isolated or you are quitting your job, definitely it's gonna impact your self-esteem. They're gonna receive a lot of, not a lot of, but at some cases, they're gonna receive compensation, either from their families or from governments. And their relationship also, it might get affected. Most of the time, they're gonna get positive attention from their spouse, which can actually maintain the pain. So let me just clarify that part. Just imagine you do have a husband or a wife, a spouse in general. They are not paying enough attention to you, or even a parent, they are not paying enough attention to you. Only whenever you are getting sick, they will just shower you with all the attention. So definitely, and I would say unconsciously, you're going to develop some sort of chronic condition and you're going to just pretend to be sick all the time to get the attention that you want. So that's what I meant about governments as well. Same goes with government, right? For example, your salary is not good and now you are getting compensation from the government. So you're going to develop that kind of chronic condition in yourself to just get the financial reward from government. There are gonna be like several factors that gonna impact chronic condition. For example, people with neuroticism, introvert people, or people who are using passive coping strategies, they're gonna be very like predisposed to developing pain behaviors. So that's why we need like some sort of questionnaires like MMPI. I guess you heard about this, to just analyze those personalities that gonna be more predisposed when it comes to pain behavior. It seems like people who are depressed or who are like suppressing their anger all the time, they are very susceptible in developing pain behavior. People with anxiety disorder, substance use disorder, and other psychiatric problem, they're gonna be, they're gonna have a higher profile for developing pain. So I would suggest whenever like people, if you are a provider or if you wanna do health psychology for your future, doing a survey, especially MMPI with people with chronic disease, gonna be very important because like some people they are just mentally like they develop chronic condition mentally. So just knowing about their personality can just help us a lot to just address their problem in a good way. There are going to be several techniques, not passive one, because we already talked about passive strategies and pain controlling, which going to be bad. And it's going to actually cause developing pain behavior. But there are going to be some techniques that can help us to just control our pain. Just understanding that some stuff, they are just sensation. Like you're going to perceive a hot surface. So you're going to actually do a reflex to just avoid that hot surface. It is pain, but it is also sensation as well. However, there are going to be some chronic condition that we should be aware of. So just understanding the differences between these two can help us a lot to just develop pain control behavior. And that's the whole idea that I'm going to talk about that in your next section.